Hi, I'm Mary Beth Stapleton, Manager of Family and Community Partnerships for Harford County Public Schools. Welcome to the Harford County Public Schools Parent Academy Real Talk. As we return to in-person learning, we're honored today to have Dr. David Bishai, our new Harford County Health Officer, and Mary Nasuta, our Supervisor of Health Services, to help our parents understand how to return to in-person learning safely for our students that are returning next week, our elementary school students, 2 days a week. So to get us started, Dr. Bishai, I would, if you could, just give a background for our parents about your public health background and what brought you to Harford County.
Sure. It's great to be in Harford County, by the way. I started my job here on January 4th, and it's been a wild ride, frankly. I left my job as a professor at Johns Hopkins School of Public Health, and I decided I really wanted to learn public health at the time when I could learn the most, and this is the time you can learn the most, managing the biggest pandemic of a century. I'm a pediatrician by training. I did a residency in Los Angeles and then got a PhD in economics before my professor job started. And it's been a thrill, and it's been great to work with excellent people here in the school. So I love my job, and reaching out to the parents and the school community is part of my job. So let's get started.
Great, yeah, let's do it. And Mary, if you could just remind parents your role with the system and what you do every day.
Certainly. My name's Mary Nasuta. I'm the Supervisor of Health Services, so my role is to supervise all of our school nurses. And we're fortunate to have a school nurse in every school building, and they'll be working as our COVID point persons in addition to lots of other tasks.
Great, perfect. So just to remind our parents, we had sent out a questionnaire a few weeks back through the Parent Academy Facebook page and through our school-based staff to ask you what you needed to know as you return your child to school. So what are the things that you're concerned about, and how do you prepare your family for this transition? So all of you sent in questions. Thank you so much. And what we're going to do is use those questions as a guide to get those answers that you need to safely return your children to school next week for the elementary, and then for our middle and high for the March 15th. And again, some families have chosen to stay virtual, but for those that are going to be choosing to do hybrid, we want to make sure you feel prepared. So the first question from a parent was just a quick update on the metrics from our health officials about what's going on with COVID in Harford County. As parents, we hear a lot from the media about transmission and high transmission, and this parent wanted to know, what is considered high transmission, and is there high transmission in Harford County? So Dr. Bishai, I'll start with you on that one.
Sure. So the numbers that you're going to see a lot of in the news and on our Harford County Health Department website are the ones that I use also to know when there's high and low transmission. So the first number that you're going to see is the number of cases per 100,000 people in a day. So that number is pretty simple to calculate. We look at our testing data and we see how many positives yesterday and divide that by the total number of people in the county. So that number is high relative to how immune we are. There'll be a time when we are so immune that one case in the county is going to scare us because, there shouldn't be any new introductions. Right now, we're still quite vulnerable, and for us to be seeing the cases per 100,000 where it is, around 15 per 100,000 right now, we're not immune enough to consider that a low number. Now, it's been higher, and so we're high, we're coming down. 15 cases out of 100,000 when most of the county is susceptible means we have to keep on wearing masks and social distancing, and everything in our playbook has to be as good as it can be at this level. Even though the numbers are coming down, that doesn't mean the fire is out.
Right.
I mean, if this were a campfire and you saw, this would be a kindling fire and it can catch.
Okay.
So we're not out of the woods on that one. The other metric is the number of positive tests divided by the total tests. And that number is also useful to correct for who is getting tested. If I am only testing a very, very few people, it might not be good enough to look at the number of cases per 100,000. And I would want to know within the tests how many are positive. That number is also running at 5%, which is lower than it's been. It's great that that's come down from its high points in December and January. But it's still showing that there is active virus circulating in the county, and we've got to keep our guard up. So yeah, it's good news that it's getting lower, but the fire was roaring and now it's kindling, and we still have to maintain our precautionary measures.
And those precautionary measures, Mary, in our schools are our masks, social distancing. I do hear that we're getting some plexiglass as well. So we are working hard to get those safety measures in place as best we can to keep those numbers going down. Is that right?
That's right. And the other thing that's really helpful is that our nurses are going to be collecting our own data too. So in addition to Dr. Bishai's data that he's going to be sharing with the county, we're going to be able to share with him how many kids have COVID-like illness, how many staff have COVID-like illness, who's in isolation and quarantine, who's come out of isolation and quarantine. And we'll do that every day and send that over to leadership here and to the health department, so we'll know how we're doing right in our school system.
Great. And I do think we had a point at one time we were looking at that on our website as well, our HCPS website, and perhaps we'll update that too.
Yes, the dashboard will be back.
Okay, great. Good to know. Another question from a parent is really how safe will it be? According to their child's pediatrician, kids as young as 2 months in her office have contracted COVID-19. Is it good for teachers and administrators that they were offered the vaccine, but what about other staff that interact with children? So just that transmission situation in the school building, is it safe? Is it not safe? I think that's something parents are concerned about.
Yeah, so the good news is that children don't get very sick when they do get COVID. Most of the time, the cases are mild. And part of not getting sick means when the virus lands inside a child's mouth and nose, it doesn't have enough of an ability to latch on to the lining of a child's mouth and nose. It can latch on, and it can try to replicate a little bit. It just doesn't have as active a lifetime inside a child's mouth and nose. So we'll see children's acquire the infection. They'll show positive tests. They'll even make antibodies, but they're not generating viruses in their breathing out as much as adults. And this is partly why we don't see large outbreaks inside schools when we use the proper measures. Children will host the virus, but they just don't generate large viral loads in their breath. And that's good news. It's not total good news because it's not perfect, right? A child, even though they're not as good as an adult at spreading virus, they do at times spread virus. And there are thousands and thousands of people who've been infected by children. It sure is possible.
Mm-hmm. And just to add on to that then with that question, we hear younger children may not spread it, but as children progress in age, are they more likely to spread it, older children?
Oh yeah, so the biology of spreading virus has to do with how the virus does its job. Let me just go over that. If I were not to wear a mask and you were not to wear a mask and we're indoors and you sneeze or even breathe or sing to me, maybe you're a good singer, but not today.
I do sing.
Okay. So if you were to sing to me, virus would come across my mouth and nose. And the first thing that virus is going to do when it's in my nose is look for an ACE2 receptor. That's a special molecule that we have as adults on the lining of our mouth and nose. Virus has to see that. The spike on the protein on the virus has to go to that ACE2 receptor and unlock the key to my cell. Virus enters my cells and then starts making babies. Now, as an adult, I have more of those ACE2 receptors. ACE2 receptors are half as many in children under 12, and then between age 12 and 18, the ACE2 receptors begin to multiply until they're adult level. That's why when a child gets coughed on or sneezed at, they just don't have enough of those keys for the virus to unlock, and the virus just sits around in the mouth and nose of a child just not getting anywhere. It just can't find a door to open. Mm-hmm. So as a child gets above 12 and 18, middle school, high school, they begin to be just as likely to get infections and high viral loads as adults. It's the little ones under 12 that just don't have the biology that allows them to get large viral loads, large numbers of virus particles in their out breath.
Okay. And just to add to that, so thinking about that viral load and that transmission question, Mary, in the school, are we going to be doing quarantining? Are we doing any testing? Can you update parents about what the plan is for that?
Sure. So this is new to us, but we are going to be instituting a testing program within our schools for COVID-19. But it's a program that's pretty small in scope. We're only going to be looking at people who present with COVID-like illness in school, and we'll be able to use rapid tests or the PCR tests to find out if they're positive. We can figure out who to isolate, who to quarantine. We think by doing this, we'll decrease the number of people that we quarantine because that was very high in the fall. Right. So the program, although it's small, I do want to just make one big caveat to our program. We're not a testing center, and so we don't want people who are sick to come to school to be tested. This is really just limited to if you're feeling sick in school, going to go home, then parents or staff can consent to a voluntary test, a nasal swab, and this is the nasal swab that we'll use. Not the nasopharyngeal, so this is a little bit kinder to your nose. Oh, yeah, I've heard
yes. Unkind.
Yes. And we'll be using two different kinds of rapid tests. One is this, the Abbott Binax Now, and then we also have a test called BD Veritor. These can be read in 15 minutes, so people will go out to their car and we'll give them a call and let them know what their test results are. If the test is positive, we'll know right away. We need to isolate and we need to quarantine. If the test is negative, we will have to do a confirmatory test to be sure that it's negative using the PCR test. Another nasal swab that we'll do with the car because we don't want those folks to come back into the school. And then we'll send that to Mako Labs, which is a state-approved lab, and we'll get those results in 24 to 48 hours. So again, although it's a small program, we think it will decrease the number of people that we quarantine sort of unnecessarily in the fall.
And I think that's great news for parents because I do think we heard a lot from parents about the quarantining and just their concerns at times about that. So it's great to know that that's a new resource for them. So thank you both for that. That's wonderful news. So another question from a parent, how do we know that although the teachers are vaccinated, the children will not spread the virus to one another? So that gets into that transmission question again. And just to back up for just a second and update our parents, for those that don't know, the vaccinations are occurring for our staff.
They are. We started all the way back at beginning of January.
And the health department.
Yes, the health department was able to really look at our frontline folks. So they were our cafeteria staff, our food and nutrition staff who has never really been off. They've been working all the way through. Our custodians and facility staff, our bus drivers and the attendants. And then we moved into those direct care providers, occupational therapists, physical therapists, speech and language pathologists who have to work very closely with students. The John Archer staff was then offered. Then we were able to do all of the elementary. They're getting their second doses this week, so tomorrow we'll end their second doses. And now we're having secondary schools start tomorrow. And we have about 450 of those folks invited, and then we'll do about 400 every Friday. So within a month or so, we'll have everybody one dosed.
That's great.
Yeah, it's pretty exciting, and we appreciate
it. Thank you for that.
Mm-hmm.
Thank you. So now that we have teachers and staff, I think that concern again that you shared, Dr. Bishai, for children transmitting to one another, that's the question is, even though staff is vaccinated, kids can still transmit it to each other, correct?
That's true.
Okay. So just to confirm that is good news. However, we still have that risk. Okay. Another risk that's come up for one parent that was asking a question around travel. What do you suggest for families that want to travel? We all have family all across the country and we want to have time together. We do have the spring holiday coming up for sure. So that has been a question that families are asking. And one parent said that they see families on social media. For example, they've been to Florida. And they see that family in their network in Florida, and then they come back, and they're just concerned because if that child's then going to school after having been in Florida or other types of places that perhaps have higher cases, is that something we should be concerned about as a community?
I would agree that it is risky to travel to other states with higher rates of COVID-19, and but it's high enough here in Harford County.
Okay.
It is higher in other communities. I'm more worried about the variants. Now, we do have some of the variant cases here in Maryland. We've got about 46 cases, and we're looking to see if that number is growing. In Florida, they have detected a lot more of the variant cases in the state of Florida than in Maryland. The thing is, it's already here. It's not like we can keep it out of Florida, out of Maryland forever. It's already in our state. But the more people go to places where there are a lot of variants and come back, the worse it is for Maryland. Okay. So I would really think that this might be the year that we just put off those vacations, stay here, and especially look at the variant circulating and don't go to the states where there's a lot of variants.
Got it. And that's hard for families, right? But I think just that confirmation from health officials that, if we can, as a community right now, come together and maybe make some choices that are a little less risky, it would help protect all of our children getting back to school. Is that right, Mary?
Yes, I think the travel restrictions have been difficult to keep up with because they've changed, and they can change while you're on vacation too. So it's everyone's responsibility to keep up with those travel restrictions, to go on the governor's website and find out what they are on the current time if you are having to travel. The other thing that I want to remind everyone is that the parent acknowledgement letter says that you are going to follow the travel restrictions, the letter that parents sign when they have their kids come back to in person. And when our employees come in during the day, they're attesting that they are well and that they're also following those travel restrictions.
Okay. And that brings us to another question from a parent about safety, back and forth to school, talking about travel within the community. Going back and forth from school to home and perhaps, in other places in the community, and there could be somebody at high risk at home for their health reasons. Is that something that parents should be concerned about for children traveling more around the community now from school or other activities?
I agree that if you have a high-risk immunocompromised person in your house, one extra thing to do is to move that high-risk individual and the child into separate pods and separate them. But your questioner is really absolutely right. The thing that threatens us the most is adults, not children, and it's adults seeing children are back in school, now's the time to socialize, and it's not. That we're still under a high risk of COVID bursting out of control, and seeing that the schools are back is not the signal that it's time to have coffee with your dearest friends. It's not. Stay the course. It's going to get better, but it's not going to be Florida that undoes Harford County. It's going to be Harford County socializing with Harford County. There's enough virus right here in the adults for the adults to say, oh, school is back, let's go and have our normal life again. We want the normal life again. Open schools and in-person learning is not the signal that it's all over, we made it to the finish line. We are almost there. It's going to be end of summer, end of fall, where we can really finally get our lives back. It's not right now. This is the time for adults to be adults and keep those precautions on.
And those precautions, Mary, bring us to another question about social distancing. Thinking about how schools can maintain that social distancing, so those are one of the precautions that are suggested. With over 15 kids in the classroom, do we have enough space to accomplish that social distancing piece to help keep our numbers down?
Well, I will say that we are committed to doing social distancing wherever and whenever possible. So you will see some sort of creative classroom arrangements to try to keep that distancing at the maximum that we're allowed to. But I also want to remind everyone that mitigation factors are sort of in layers. So the masking is really important, but not by itself. It needs to be with the distancing. The distancing is really important, but not by itself. It needs to be with the do not come to school when you are sick. Hand washing is really important. It also needs to be a part of the sanitation and the cleaning that we do through the day. So all of those factors together are what keep us safe, not just one. And I think it's easy to sort of focus on the idea of, can we really do 6-foot distancing completely all the time? I think that's a challenge in every school across the world right now. We'll do the best that we can by making sure that we've engineered ways to keep people at the maximum distance that we're able to.
And that includes, as children, perhaps if we go more days back, we'll do our best to keep that 6 foot. That's always going to be a parameter that we'll use.
Absolutely, and I think that parameter comes from the fact that we define a close contact as anyone who's within 6 feet for a period of cumulative 15 minutes. So we already know that once we have that distancing decreased, that contact tracing becomes more difficult, we get more quarantine. So whenever possible, we're going to keep people as far apart as we're able.
Okay. And we did talk a little bit about the 6 foot, the barriers and such, but as far as one parent asking, a scientist, healthcare provider, do you think the risk of transmission for students sitting closer than 6 feet with masks is a concern? Do you see that as ever an issue? I mean, to your point, we're going to do our best to keep 6 feet apart, but if a child, for whatever reason, has to be closer to another child or to a staff person, is that an issue?
I mean, everything we can do helps.
Okay.
And there are multiple layers of protection, right? So we're keeping masks on all children. We're keeping distance as much as we can for as long as we can.
As much as we can.
We're testing. We're asking everybody to do their measures at home. All of these are multiple layers of protection. And we want them all to be operating as much of the time as high as possible.
Okay.
Everything that we can do, the better. We're not putting all of our defenses on one item. It's not going to make or break on the 6 feet. It's going to be as much 6 feet as we can. Masks above the nose at all times. More masks, better masks. Getting our hand washing. Everything we can do is going to help.
And one of those things that parents are asking, Mary, a question that came up over and over, what about those temperature checks, right? Is that one of the ways that we can keep our children safe by having, one suggestion from a parent was, can we check for temperatures as they get on the bus? Another parent was asking for temperature checks prior to they entering the school building. And I know you have some thoughts around that, so if you could share.
Lots of thoughts around that. One of the problems that we had really in the fall when we came back was that same question: should we take temperatures on every child? But science tells us that we do not want these folks in our buildings at all. So the idea of taking a temperature once they come to the building, they've still had all this exposure. So that's the reason the acknowledgement letter talks to parents about monitoring symptoms and monitoring temperatures at home, and the same for our staff. Because once they've come into the doorway, obviously we've already had exposure. The other issue with temperature taking that we found is these infrared thermometers are often inaccurate, especially when we're talking about very cold weather or very hot weather or kids with hats and coats and scarves. And so we're not getting a very accurate measurement, and we may be giving ourselves a false sense of security, thinking that we're taking temperatures that aren't accurate. And we have many people who are asymptomatic with COVID or afebrile, not having a fever. So the idea of temperature being sort of this golden rule really doesn't stand the test of time. So far, we've found that this is a really good way of monitoring kids, monitoring at home for symptoms, because parents know their kids very well, and they'll be with them for a longer period of time, and then checking their temperatures there. I would also say that the congregation that it takes to do all that temperature is sort of against our distancing. So we sort of have to look operationally at how temperatures work. We, of course, will take temperatures on kids who are sick, and if a parent asks us to, we certainly will. But that sort of congregating to get a temperature check really hasn't proven to be a great way to decrease COVID exposure.
Mary, how can we eventually start to take away some of those mitigation strategies, right? So parents are wanting to know, when are we going to get to the point when those plexiglass barriers go down and those masks are coming off and that's normal day-to-day experience for children return to them? Any thoughts on when that happens?
I think we all have nostalgia for the very recent past. Yeah. We all want to know, when's this all going away? Yeah. And I don't want to put up unrealistic expectations that we'll be able to do that really before the end of this entire year. And so I think that's hard for people to hear, but I think some of the mitigation strategies that we put in place are actually going to help us in the long run in public health. I think the emphasis that we've had on hand washing and staying home when you're sick have really been things that we've been pushing in public health forever, but now have gotten sort of the airtime that they really require. And I think we'll start to see that although we'll pull back on some things will remain. Respiratory viruses have always been a problem for us in schools because, you know, they're so pervasive in the winter and the fall.
That, right? Yeah. We experience it every winter.
Yes, every fall and winter we have this. But we have known some things that have worked for us. Respiratory etiquette, which we've been working with kids, coughing in your arm or your elbow or your shoulder, has been something we've been teaching kids for a while, washing their hands. All of that stuff is going to remain. I'm hopeful that we'll get rid of the plexiglass sooner rather than later, but it's all going to depend on the metrics. And I think the metrics are within our control, and it's not just the actions and behaviors at school, but also the actions and behaviors at home. And so I think Dr. Bishai did a great job of explaining that we can't let our guard down. And that's actually the social media message today on Twitter for the health department. We can't let our guard down. And just because schools are open doesn't mean that we need to make multiple trips to the grocery store. We need to do just what we were doing before, which was, trying to limit those exposures whenever possible. So I am hoping that mitigation stuff can go away for certain like masks and plexiglass, which seems so restrictive. But I think we're going to have to wait and see what the numbers tell us and how much virus is transmitting. I will say that I was pleasantly surprised with our pre-kindergartners and kindergartners when they came back in the fall. They were my best mask wearers in the entire school. And one of the kindergartners, one of the kindergarten teachers said to me, they've never gone to school without a mask. So they think that's just what you do. And so that was in some ways kind of sad, but also it really shows the resilience of our children, that when you give them something that we know is going to keep them safe, and we do it in a way that message is positive, I think they will comply and make it a more normal activity. We don't like it that it's normal for our kids to wear masks, but right now for the little ones, it is their experience. It's all they've known.
And to that point, you do have some extra supplies on hand in the school, right?
Yes, we do.
Little ones that might have forgotten, or all of the things that you have there.
Absolutely, and we have the smaller child-size masks. We have lots of cloth masks. We have lots of ways to help families to get the mask wearing to be a little more positive. But I will say to parents, you are your child's best teacher, but you're also their best role model. So you wearing a mask without a negative commentary really can be helpful. It's what we do to keep each other safe. And I think if we're very clear about that, I think that children comply and are sort of happy to comply with those rules.
Well, it's good to know that we have all those supplies on hand just in case, because we have those busy mornings where we forget and somebody ran out of the house and they didn't have their masks. So it's so great to know the school has them to get that resource from their school nurse, right? That's probably where they would go.
That's where they'll be located,
Okay.
Yes.
So thinking about the masks and all of the other restrictive barriers, some questions have come up about, is this in any way harmful to a child's emotional health? Is there any science around that, or any impact that could have on them to see masks and to see the barriers, in your view, as a public health official?
There's no evidence that the concern shown around safety is harming children. We do know that there's many mental health harms. I don't think that those are primarily driven by the need to take public health precautions. They're driven by isolation and change and fear of the unknown. Okay. But the simple idea of needing to social distance and wear a mask isn't been shown to be harmful in and of itself. Oh. The thing that as Mary was getting at, the meaning we create on it, the stigma we put on it, really matters. So luckily, we're not a county that teases children for wearing a mask and washing their hands, right? There are places that tease you and make you feel bad for doing this. And it's up to us to keep that approval and positive messaging of good job. This is what we do to take care of each other. Wearing a mask is an act of consideration and kindness. That meaning, that understanding of the adults has to go on to the children. And so that the children have to say, this is just, it's what we do to show consideration and politeness to each other.
Nice. That's a good model that we can have as adults as well. I think that's something we need to reiterate.
There is sort of a silver lining in all of this, because as much as we'd like to shield our children from the scary part of this pandemic, we have been able to teach kids resilience and coping skills. And I think I've been really encouraged by the children I've seen who have really taken this and decorated their masks and talk with other children about wearing masks. And I think when I think about what we can do, because there are certain things we can't do. We can't get rid of our masks yet. But things we can do is we can start to create those healthy environments for our children, those mentally strong places to live, since right now their houses, so their school. And so I think about going back to all those basics that we did, and I'm sure you remember this, Mary Beth, as we started to get out of summer into the fall, we started to make all those routines much more apparent in our own home.
Yes. So those bedtime routines, the morning routine.
Eating at the table together as a family, nutritious food, exercise. Sleep hygiene is something I don't think we talk nearly enough about, and it's a real problem right now with our teens whose circadian rhythms are always a little off but they're staying up all night because they can. So trying to get those routines and structures back for families is going to be really, really important. And if you do worry about your child's mental health, I urge you to talk with your pediatrician or a mental health professional, just like you would talk to your doctor if your child had a broken arm or had asthma. We have to get rid of the stigma around mental health, and we need to talk about it and bring it out in the open. And when parents are worried, they know their children best. So if they're worried, I'm worried. And we need to get the health professionals that can help support them in place. So I really urge parents to use this time to parent, and that's the hardest job there ever is. I also encourage everyone to think about using the American Academy of Pediatrics website, www.healthychildren.org, which really goes through stages and ages and all kinds of topics that are really pertinent to different age groups. So parenting is hard. We all support each other. But I think leaning on our pediatricians who really know children and using those resources can be really helpful.
Well, let's just finish on a last question from a parent about the fall, right? What's coming in the fall, the school year next year? And I know all of you, are thinking about that, planning that, but just thoughts around, do you think that we're going to need masks in September? Do you think that we're going to have these same mitigation strategies? I know you can't predict the future, but just any thoughts about what we might be looking at for returning to school in the fall?
So I think the way the fall looks depends on us.
Okay.
And for me to say guarantee, no, what will happen in the fall depends on what we do in March, April, May, June, and July, and we control that fall. So there's one version of fall where we do the work of maintaining our public health measures, our masking and our distancing, and eliminating our contact with people indoors. If we do that and we get our vaccine rates up, the brightest possible future could be there in September where we see it. Now, I don't know how good we'll be. I've seen how bad we've been. Mm-hmm. And if we stay that bad, if we stay the way we were for the last 12 months, I don't predict the future. Because you look backwards, you see 3 waves. You see a repeated cycle of an epidemic, and then we get religion, and then another one, and then we repeat. We haven't shown an ability to stay the course after a peak. We haven't been able to stay the course. So our past doesn't give me a reason to say this bright future is ahead. But after 3 times America, you've seen 3 waves of this. We're adults. We're smart. Can't we finally get it that March, April, May, you don't get to take your mask off. You don't get to go and have, elimination of the 6-foot rule. You have to keep with it. It's not over yet. So what happens in the fall is 100% in our control now, to be different from the way we handled the last time we came off of an epidemic wave. Okay. Many counties have done it in America. Mm-hmm. There's counties that have had 1 wave and didn't have 2 or 3. Mm-hmm. There's whole countries that did it. Mm-hmm. So why can't Harford County be the county that everyone looks to and says they did it? They were the ones that after March, after February, they stayed the course and they were able to get back to in-person learning, took down their plexiglass. Let's be that county.
Oh, that's great news. We have hope. If we just keep at it, we have hope. Well, thank you both so much for being candid, clear for our parents about what the situation is for returning to in-person learning and what our future could look like if we come together as a community to really try our hardest to keep these numbers going down. So thank you both so much for being here today. And thank you for joining the Parent Academy Real Talk. And remember, our parents are our children's first and best teachers. Stay well.